Hi everyone, I'm Zainab from eGlobalDoctors, host for today's FB live session. Well, if you are from Indian origin, living in US, and if your parents are visiting from India, you do not need to worry about their medical needs in US. eGlobalDoctors has your back. They have the best packages that provide access to 300 plus doctors from USA and India with 30 plus specialties. In addition, prescriptions will also be provided. They get back to you within 1 to 3 days of time. Now, even the family members can participate in live video session, physician consultation from any part of the world. Video consultation can last up to 30 minutes. In-app messaging with doctors after consultation, ID and portable health passports will also be available. If you are a doctor willing to do televisits and looking for building your networks, join to provide consultation from anywhere in the world and be a part of fast-growing and innovative telehealth company with liability insurance covered. Visit www.eglobaldoctors.com and register yourself today. So let's welcome Dr. Gireesh, MD, we have with us today. He's currently working as neurologist at Advent Health Orlando, both certified in neurology, neurophysiology, epilepsy, and neurocritical care. He did MBBS from Calicut Medical College in India. He not only has experience as assistant professor in University of Florida, but also focus on use of artificial intelligence technologies in neurological conditions. Welcome to today's FB Live session, Dr. Gireesh. Thank you for joining us.
Thank you so much. Thanks for having me.
How are you doing this evening?
I'm doing good. Thank you. Thanks for asking.
So can I start with my first question?
Absolutely. Go ahead.
What is a stroke and what are the different kinds of it?
So today we are going to discuss about the stroke, right? Stroke is it's a condition that is affecting the brain where the function of the brain get affected because an area of the brain does not get either no blood supply or bleeding happens into the brain. So that's usually the big definition of stroke. So let me start by telling about what is the severity of the stroke in a global scale. So annually, there is approximately 15 million people being affected by stroke. That is every year, 15 million people get affected. And out of that, around 5 million unfortunately die, like 1/3 of them. So to put things in perspective, so if you consider 1 year in 2020, around 3 million people died of COVID. So for comparison, so 5 million died of stroke in the same year. So that is the global scale of in terms of death. But the other part is another 1/3 will be permanently disabled because of the stroke. So they will not be able to go back to their daily life, like their routine life of their whatever job they were doing or whatever. If they were like active physically, they will not be able to go back to their routine life. If you take it only in India, around 1.5 million people get affected. That's like 1/10 of the total number of people get affected globally. So 10% of stroke patients are in India. And if you look in a different way to look at it is 1 in every 5 to 6 people, like 1 in every 5 to 6 people get affected by stroke in their lifetime. So that is the gravity of the stroke and like why it is an important issue. So to the question, what are the different types of stroke? We usually encounter ischemic stroke. Ischemia means like an area of the brain is not getting adequate blood supply, or hemorrhagic stroke. Hemorrhage means like the brain, in some areas of the brain, the blood vessels may rupture and there will be bleeding into the brain. The brain needs blood for its functioning, but it needs to stay inside the blood vessels. Brain does not like blood outside the blood vessels. So those are the two common types. And out of this, 80 to 90% is ischemic stroke, like where there will be narrowing of some of the blood vessels. That narrowing can be anywhere starting from heart all the way. I mean, mainly the carotid blood vessels, those are the two blood vessels that are in the neck that pump the blood up to the brain, or inside the brain also. Like there are several small blood vessels that can get narrow. We usually encounter that scenario due to atherosclerosis. There is another reason why people can get stroke. It is called an embolic stroke, where like blood clots either dislodged from heart itself or coming from somewhere else, or in some cases, if the blood clot is dislodged from like lipid laden areas, like if there is patches in the blood vessels, which are, we call it atherosclerosis, they can dislodge and act as a clot and block brain blood vessels in different areas of the brain. That will lead to lack of blood supply in that region, and that can also lead to stroke. So big definition, usually either it is an ischemic stroke or a hemorrhagic stroke. That's what you usually will hear from the doctors who treat this.
Thank you, doctor. That was really informative. So what are the difference between TIA and stroke?
So yeah, this is something that if you come across with any of the patients with something like stroke, or who had a partial symptom of stroke-like phenomena, you will hear this TIA word. So I want to go into that a little bit detail. TIA is essentially a transient ischemic attack. Means like in some area of the brain, there was a period for which there was not enough blood supply. It did not lead to a permanent damage. It led to a transient damage, I mean, like a transient phenomenon. It is a good warning sign that that person potentially can go into stroke pretty soon. So that is the importance of knowing TIA. People, so if the patient, if they had a weakness or disability with speech and they recover within 24 hours, usually we regard it as a TIA. In that case, the brain pictures that we take, like CT scan, MRI, may not show actual damage there, but that indicate that there is a potential for this person to go into a stroke. A stroke, which is a progression of the damage without a reversibility. So the brain is an organ. Unfortunately, the neurons do not regrow. So because of that, in case of stroke, there is permanent damage. And the only way, to some extent, patients can recover their function is by rewiring, like rerouting of the function. So going back, TIA means a transient thing, people recover. The good side of that is it's a good warning sign. You need to act immediately, seek medical attention, make sure that you take care of the risk factors, which we will come to in the next few questions. And the stroke is where there is permanent damage. Okay.
That's really shocking, doctor. Thank you for the information. So what are the clinical symptoms of stroke, doctor? And like, how does it feel?
So when we talk about stroke, it's in general parlance, it is better to remember it as a mnemonic, like an easy word to remember. So previously we used to use fast, now it is called be fast. So the idea is to remember easily and recognize stroke easily. Say somebody or a family member or a friend is having a stroke, others can recognize it very fast. So the mnemonic is be fast. B is representative of balance. So if somebody is having a balance issue. E is for eyes. If they have a problem with the vision, especially on one side of the visual field, like either right side or left side, that is the E representative. Pace or F represents like weakness on one side of the face, and the next is arms for fast. So either arms, legs, or face, if they have weakness, that is another sign somebody is developing stroke. And another one is speech. So speech sometimes can be tricky. So even if they have difficulty with speech on expressing or understanding, so like usually people tend to miss if they just have a trouble with understanding the speech. So they may keep talking, but they may not make sense. Okay, because like they are not able to understand if you are talking to them. So that is the S of the B fast. And the last letter, T. T is indicative of time. So that is related to the available treatment options for people who are suffering from stroke. So it's the available treatment options are very time limited. So let me put it the other way. Like, so if you look at the situation where brain is not getting enough blood supply. So every minute, this is for an average stroke, okay? So every minute brain is not getting enough blood supply. Every minute, approximately 1.4 million neurons are dying. So like every minute in delay to the treatment, the right treatment causes that many neurons to die. And around like 7 billion or something, synapses will also die. Synapses are the connections between the neurons. They are where our memory is sitting, like how we are talking, how we are memorizing, how we are like able to say, like even do some of the trained things like biking, swimming, any of those. All those learned things are sitting in the synapses. They are like our the common analogy is to the hardware, like where we keep the memory in the computers and all. So it is all over the brain. So that is, those synapses will also get affected by the lack of blood supply. So the longer it goes, more neurons get affected. So the T indicates, it is a reminder to the people who are around or to the medical people who are taking care of this patient. We need to get this patient treated as fast as possible. So it's be fast. I will come back to that at the end with a picture representation also.
Okay, thank you, doctor. So, doctor, as we are having one question from our viewer, that is aphasia an isostroke?
Aphasia is, what is the second one? I didn't get it.
Aphasia is an isostroke, doctor.
So if they meant, if aphasia is a stroke, aphasia is the medical term for difficulty with speech. Okay. So aphasia can be due to stroke. There can be other reasons also. So like if, I mean, I cannot go into all the possible causes. Commonest one is seizures, or if somebody has a tumor or something in that particular area that is controlling the speech, that can cause also aphasia. But if somebody is developing aphasia, like since we are using that word, aphasia means difficulty with speech. Acutely means like you saw this person in the morning and afternoon, you are suddenly seeing this person having difficulty with speech. That is very likely to be stroke related. That patient needs to get immediate medical attention. Yes.
Okay, thank you, doctor. So we wanted to know, like, what should family do when stroke is suspected?
Yeah, that's a good question. So like what should they do, right? Like family or friend around this person who is suddenly having a neurological symptom, like if like among this be fast, right? Like a balance, eye problem, like vision problem, or weakness on one side, or speech difficulties. So the first thing is they need to get arrangement to get to a good hospital. Like, don't get confused at that time. This person need a good hospital. Okay, like there's no point in taking this person to a clinic. It will actually delay the treatment. You know, like first they will have to make an assessment. Then most of the clinics will not be capable of it. In your situation, this is a 911. 911 is like an emergency call. So that way the person will get immediate access to the emergency care there. They should not go to an urgent care or anything less. So they need to call 911. That's the best strategy to get to the right place. In Indian situation, get to a good hospital which has ICU, like capable of like monitoring, CT scan, at least CT scan kind of facility there. So those kind of, I may have some documentation on that towards the end where people can take and all, but that is the most important thing. Another thing is make them lay down so that assuming it is most likely to be an ischemic stroke, they have a reasonably good blood pressure up to the brain so that the brain does not get more trouble. Another thing is that better not to feed them because they have a risk of aspiration. Aspiration means like the food may go into the throat and they can choke, all those things. So those are the important things that they need to remember. Another thing is when you are reaching the hospital, one important question, or like there are several questions. One very important question is when the patient started having these symptoms. So that kind of determines whether some of the medications can be administered or not, whether there is a benefit of administering some of the medicines or not. So because of that, it is better to, the person who is taking patient to the hospital should be aware when did the patient started having symptoms and what was the baseline. Baseline means like what was the status of this person prior to them having the symptoms. Another important thing would be having information of the medicines that the patient is taking. You know, like they may be taking medicines for several reasons. They may have a heart condition. They may have a problem with their lungs. They may have blood clot issues. That is specifically the important one. If they some of the emergency medicines that can be administered for stroke may not be, I will not say cannot be, like may not be. In some cases, they may not be able to give that medicine. So having all those information ready will be very useful for the treating team to take care of the patient immediately.
Okay, thank you, doctor. That should be noted down. Prescriptions and when he started the stroke, when the patient has started the stroke.
That's correct. Also, if the patient already had some symptoms, so like some people may already have some weakness. So those things, if the person, I mean, in India, we call it bystander, or like whoever the family is taking care of this person, if they have that information, that will be very useful. Yes.
Yes, thank you, doctor. So what test one may need to do in case of having a stroke?
It's it varies. Okay, it depends. That's the best answer. But let's divide into immediate tests and more subsequent tests. The most important immediate test, I mean, most of the hospitals will take care of EKG, blood tests and all, but few critical tests are like CT scan. That's very important. That helps in differentiating whether, remember we talked about whether it's an ischemic stroke where like brain is not getting enough blood supply versus the hemorrhagic stroke where there is bleeding into the brain. So that is the bifurcation point where the treatment differs. So CT scan is a very important step in this. So that's why I was telling when somebody is taking a person with this kind of symptom, it's at least that hospital should have a CT scan. That is the most easiest way to differentiate this problem. So once we institute treatments based on the initial test, there are additional tests possible, like CT perfusion scan. It's a way to decide if there is salvageable tissue, that is rescuable tissue in the brain for additional interventions. So, like there are different types of interventions they can do. One is the clot bursting treatment. In addition, they have interventional treatment, which we can go a little later. So those scans like CT perfusion scan, MRI perfusion scan can also be done depending on the availability of the facility in those hospitals. Then once we manage the patient acutely, then the second question is, did this why did this person develop stroke? Okay, why did this suddenly happen, and how can we prevent the stroke in the future? Like everybody has different risk factors, so we need to identify the specific risk factor that this person had so that we can prevent it in the future, right? So for that, routinely we do carotid duplex. Carotid duplex is a study to check how well are the blood supply going from the heart all the way to the brain. There are different ways to study it. Angiograms can be done. Angiogram means like injecting a dye into the blood vessels and check the patency of the blood vessels. So that those are strategies. Echocardiogram can be done or should be done to check if the heart is functioning. There is a very specific condition which we can go a little later, but it's called atrial fibrillation. That is essentially the heart is beating in an abnormal rhythm. It's common in elderly population, and that may lead to blood clots forming within the heart because there is stagnant blood there, like blood is not flowing adequately. So that will lead to stagnation of blood, which leads to blood clots, and that can dislodge from the heart and end up in the brain. So those are the things that are evaluated as a second step. So once we manage the person immediately, like clot busting medicine, interventional procedures and all, then you need to evaluate the person for other risk factors. And sometimes we need to explore rare risk factors also, like there are genetic disorders that may predispose somebody to the stroke. So those needs to be evaluated also.
Thank you, doctor. So how can a stroke be treated, doctor, acute and chronic both?
So the acute treatment, that is what we delved into a little bit in the previous question. Acutely, the reason why we talk about the time and all is come from the idea that if it's a blood clot related stroke, you can lyse the clot, means like dislodge and dissolve the clot with a specific medicine. It's generally called TP8, like a tissue plasminogen activator, and it comes in different forms. There are different types of it, but that's a medicine that is time limited. Generally, it can be given up to 4.5 hours. Then there is, based on the doctor's discretion, sometimes it can be extended a little bit more and all. So that has shown to be the most beneficial so far in terms of like recovering the lost functions this person may have. At least it will prevent further damage to a greater extent. Then there are advanced treatments, like if there is a blood clot sitting there that is especially not getting dislodged even with this medicine, that people use interventional strategies, like put a catheter through the groin and all the way to the blood vessels, all the way up to the brain, and try to take out the blood clot. There are different technologies. Like unfortunately, those technologies are not available even in US. Not every hospital has that technology, and it's same thing in India also. So for that, in some cases, these patients may have to be transported. So then once this issue is addressed, if addressable, if it is addressed, then you have to make sure that the brain is adequately getting blood supply, that it's about blood pressure management, also about additional care that this person may need, making sure that they get adequate nutrition, they don't get ulcers, they don't have aspiration. Aspiration means like, as I mentioned, they have a risk of their own saliva or secretions going to their trachea, causing sometimes choking, and sometimes it can cause pneumonia, infection, all those things. So those are the things that you want to prevent. You know, like somebody who has a stroke is already in a difficult situation. So you want to prevent any additional complication. Things like blood clots, because they are not moving enough. So that can cause blood clots in their legs and all, and that may dislodge and end up in the lungs, which can be disastrous. So there is immediate management and kind of a secondary management to prevent additional issues. Those are they all come under the immediate management. Then we are talking about, say, if somebody had a stroke, and even if they might have partially recovered, but still, say, like they still have some weakness, they still have some difficulty with speech, language, and all, they need to undergo rehabilitation. There are different type of physical, occupational therapy. For example, they like so whenever, just as I mentioned, like these neurons are getting damaged, so they are losing memory, maybe it will be a memory related to fine finger movement, like how to button their shirt, or like how to dress and undress. So those kind of finer aspects of their learned motor activity is lost. So in those kind of situations, they need further training. So occupational therapy helps significantly in those kind of situations. Another thing is, as I mentioned, about speech and swallowing. If they have lost the ability to speak, they may need to undergo speech therapy. If they have difficulty swallowing, in some cases, they may be able to retrain, like with different consistencies of food initially, slowly moving back to their regular food. In some cases, unfortunately, they may need to like a peg tube, like directly giving food to the stomach. So those kind of situations may also arise depending on the severity of stroke and what. So these are the broad outline what they may, and like if one of your family members or friends have a stroke, these are the approximate possibilities of treatment. But like the immediate treatment is important, and so that is very like emergent. So and for rehabilitation treatment, you have more time to think about, and or like what kind of approaches are best, whether you need to get a second opinion, all those things.